Good afternoon, everyone. This is Jen Rombalski from the La Crosse County Health Department, and I'm here today to talk about a couple of frequently asked questions, and I just want to share some facts with you as we continue along this line of COVID-19 and our response. So first of all, how long does the virus live on surfaces? What we know is that predominantly this virus is spread by droplets. Again, when you cough or sneeze, you expel those droplets into the air, and if someone is within 6 feet of you, they can pick up those droplets and breathe them in, or they can get in through the eyes, nose, or mouth. In addition, we think there is the possibility that individuals may cough or sneeze onto an inanimate surface or object. So that could be remotes, doorknobs, light switches, things like that. And you could touch that surface and then touch your face and infect yourself that way. So there is that possibility, and we just want to let people know to be thinking about cleaning surfaces with normal products, Lysol products, things like that. There's a list that you can find on the Environmental Protection Agency or EPA website to help you know for sure that the type of supply you're using is effective against COVID-19. When should people be getting tested, especially if it's mild symptoms, and what's the turnaround time on testing? So right now the guidance still is with regards to testing based on risk. And so at this point we're looking at individuals who have a travel history. So that would be if you've traveled internationally, and particularly if you've traveled to Europe, South Korea, Iran, China, those countries we're looking at, have you been in those areas? In addition, domestically, we're looking specifically right now at the states of California, Washington, and New York. The number of states may go on the list. That may increase as we continue even into the next day or two. We may begin to see other states pop up that have community spread. So pay attention to our website, which is a separate website specific to COVID-19. That address is lacrossecounty.org/COVID-19, and that will help you stay up to date on the international countries and states domestically that we're looking at in terms of the risk level. So if you have a travel history to those locations and you develop symptoms, then we would consider you to be at risk, and we would recommend perhaps that you get tested. If you have not traveled and you don't have contact with a confirmed case, right now our suggestion is not that you would need to be tested. So let's just say, for example, that you've traveled within Wisconsin, or you've been to Minnesota, and you come back to your home and you develop a cough or a fever, and you're wondering, should I get tested for COVID-19? Right now our answer would be call your healthcare provider and let them know that you have those symptoms. They would likely be looking to test you for things like influenza, RSV, maybe even strep throat if you have a sore throat, before they would be testing for COVID-19, because we're really focused in on people who have a travel history to known locations or with cases that are confirmed. As far as turnaround time on testing, it depends upon where you go. If you're going locally to Gunderson or Mayo, for example, Gunderson is sending their tests to the Wisconsin State Lab of Hygiene, and that testing turnaround time is about 2 days right now is what we're seeing. It could be, it could be sooner. Mayo is testing through Rochester, and we think up to a day or so is currently what we're hearing about in terms of the turnaround time on test results. Just a note to say that if you're currently in quarantine because you've spoken with someone, including the health department, to say you have a risk level and we want you to be in quarantine, then your quarantine continues for the full 14 days. Even if you get a negative test result. And we're trying to contact folks that have gotten a negative test result to remind them that if they were ill and were in isolation, they remain in isolation for 14 days. If they were not sick and they're in quarantine, they remain in quarantine for the 14 days. What resources exist for those with food insecurity, including food pantries and the services available there? So I will let you know that when we think about school districts closing down, some are closing sooner than Thursday morning or Wednesday at 5 p.m. Some are closing after school on Wednesday. Those schools are looking at the student population that they serve to try to make sure that the needs of those students is the highest priority, and that includes food insecurity and access to food during what normally would have been the school day. So school districts are working on and thinking about that. In addition, we did get information, a release from Wafer Food Pantry, which indicates that they are going to continue serving the community. They will change some operations for the safety of patrons, volunteers, and staff. And they indicate that if you attend or go to the food pantry at Wafer, you'll be greeted by a volunteer who would perhaps give you they would gather information to include your name, and they would look at your family size, and then they'd give you the services that you might need from there, the amount of food that you might need. You would be asked to bring with you your current ID and a personal cart to move the boxes if that's available to you. The next question is, are there cases here? There are not currently any cases in La Crosse County, nor in the surrounding counties that I'm currently aware of. And we will make sure that we notify the public at the first available opportunity that we get that case. We'll let you guys know about that as well. Do keep in mind that if individuals work in La Crosse County but they live in a surrounding county, that case will go to the jurisdiction in which they live, and it will be the responsibility of that health department or that jurisdiction to release that information to the public in conjunction with the state. If that happens here for our residents, we will be doing that within 1 to 2 hours to let the public know about that case. We are expecting a case. We are having lots of negative tests right now, so we are not going to be surprised if and when we get that first case in La Crosse County. Addressing social distancing. I want to just share what social distancing really means. So social distancing is a tool that we use in public health to help reduce the spread of diseases and infections. So in this case, we're talking about a virus where we're looking at the way this virus spreads, which is within 6 feet through droplets, as I mentioned before. So social distancing includes looking at any congregate settings or any face-to-face interactions in which you might be within 6 feet of another person, particularly if you are ill and you have symptoms, including a cough, and are potentially expelling that virus into the air. So when we look at social distancing, we have a number of ways to do that. One is through school closures that the governor announced on Friday of last week. Another is the governor just announced that we will have a ban on any events of 50 people or more. So we may see some events pop up to be smaller, 20 to 25 to 30 groups. We're still encouraging people to be really cautious about who's going to be in the audience. So particularly if individuals are sick and attending that event, also if individuals are 60 and older, and or anyone who has immunocompromised immune systems, because we don't want those folks to get sick. They could be more severely ill and or hospitalized or even die from COVID-19. So that's what we're trying to prevent. If you are asked to be in quarantine or isolation, what that means is that you should not be going to the grocery store, you should not be going to the pharmacy. We would want you to be ready, knowing that you might be asked at some point to be in quarantine, or you might need to stay home for other reasons, to include being ill. Do you have the over-the-counter medications you need? Do you have the grocery supply you might need for 14 days? And just thinking ahead about those, including pet supplies, to make sure you don't have to go out during that 14 days and you can be comfortable in your own home. Now, we do tell people, if you don't live in a highly populated area, for example, or the street you might want to walk on outside is not populated, think about what you're going to do if you are out walking and someone approaches you, just making sure you're not within 6 feet of someone while you're in quarantine or isolation. We do want you to get fresh air. We want you to be outside. If you can sit on your deck or outside in your backyard if you have one, those are the kinds of things we want to continue to encourage healthy behaviors, if at all possible, while you're under quarantine or needing to be home for a time period. And lastly, should daycares close? At this time, we received guidance yesterday evening indicating that we do not want daycares right now to be closing. Now, that will depend upon the daycare itself. Some are in conjunction with school districts, so we recognize that that is not the same for every daycare, but we certainly don't want daycares to be closing, and we are working with our community right now to assure that we have daycare available for those that are at the direct front lines of this response, thinking about healthcare workers, even long-term care facility workers, those that really need to be at work and not having to call in because they need to take care of young children at home. So I think that covers the frequently asked questions that we have for today, and we'll look forward to seeing you again next time.